Thank you very much. I'll present our research project, which is entitled Assessing the Effectiveness of Family-Based Approaches Aimed at Prevention and Sustainable Self-Management of Disabilities Impacting the Quality of Life, Mental Well-being, and Participation of People with Leprosy, Podoconiosis, and Lymphatic Filariasis and their families in the Amhara region, Ethiopia. Here is the project number. The project team members, I myself, Moges Wubie from Debre Markos University, from Ethiopian National Association of Persons Affected by Leprosy, Dr. Nurling from Debre Markos University as a program manager, Professor Alice Shippers from the Disability Studies in the Netherlands, and Dr. Anna van Noordende from the Disability Studies in the Netherlands are the team members. Here is our presentation outline. It will have an introduction, objective, methods, the current and the future tasks, result, and acknowledgement part. As an introduction, leprosy is a chronic infectious disease which affects the nerve and the skin. It creates the disfigurement of the hand, the foot, and the eye, which leads for disability. On the other hand, also lymphatic filariasis is caused by a parasitic worm, which are bankruptcy, Burja Malay and Burja Timor, and which affects the lower and transmitted by mosquito bite, the infected mosquito bite, and which affects the lower and the upper limb, as well as the scrotum and the breast. And also, it also leads for the disfigurement and disability. Similarly, podoconiosis is a non-filarial elephantiasis caused by the minerals in the soil. Those persons who go in barefoot exposes for this red clay soil, and we will have developed the lower limb swelling. These are the three entities. They have multiple effects on the affected individuals, but also on the family members. Stigma and discrimination, mental health problems, participation restriction, social consequences, as well as psychological consequences also happen on the affected individuals, but also on the family members. All over this, which deteriorates the family quality of life. Here is our justification. Previously, we studied the impact of the three entities on the family quality of life. We have done an exploration of family quality of life, and we conducted family-based approach intervention. However, we were not addressing a number of questions during that time. In order to say it is effective, we had no comparative group previously. So in this, again, relatively during that time, it was, we used a small sample size, but now it's a large sample size. And it will have a comparative group. The previous one is a cross-sectional, and our current one is just, it will be a randomized control trial. So these questions are raised by the team members. How effective is the family-based approach aimed at the prevention and sustainable self-management of disabilities due to leprosy, podoconiosis, or LF compared to the usual practice and care, which is only focus on patient aspects, on the affected individual aspects. This is our objective, to assess the effectiveness of family-based approach aimed at prevention and sustainable self-management of disabilities, impacting the quality of life, mental well-being, participation of people with leprosy and podoconiosis or LF, and on their family members. In the meta section, we'll find this one. This research project has three phases: the preparatory phase, the implementation of the family-based approach intervention, and the follow-up and evaluation phase. In the preparation phase, accomplished tasks. This report also mainly focuses on that. So just I present here the tasks accomplished during the preparation time. Ethical clearance obtained from the Debre Markos University Health Science College institutional research ethics review committee. Human power recruited and employed. In general, one program manager, which is a PhD holder, and 4 research assistants employed. Among these 4, 3 male. Again, one of male the research assistant's mother is affected by podoconiosis. So we were lucky on the mix of this group of individuals in our research team. Training was given to the research assistants. Site selection also performed on the Amara region, in the Tuzum, which is, as you see here, in the West Gojam zone, the Dagadamot, and the Dembecha, again from the East Gojam zone, they emerged in Ogawarana. Again, RCT registered in the Pan-African Clinical Trial Registry. Given this number, again, the study protocol published after submitting our progress report on BMG obtained. We will use different measurement tools for this study. Among these, knowledge, attitude, and practice, family quality of life, stigma assessment and reduction of impact stigma scale, participation scale, patient health questionnaire, and qualitative data guiding questions. Among these, 3 of them is not validated. So in the preparation phase, we do this family quality of life, SARI stigma scale, and participation scale were not validated. So we follow, as you see here, this procedure. We do a qualitative just to check the semantic, the conceptual, the item operational equivalence, content validity, as well as just we collected quantitative data on 302 group of pupils and 50 repeated. Then the data entered in EP data and SPSS and AMOS software used for the statistical analysis. The current and our future tasks will be the randomized control trial cluster design will be used. Our sample size is 630, 210 persons with leprosy, 210 persons with podoconiosis and lymphatic filariasis, and 210 family members follow-up and evaluation on the study also to the future. Here is our expected outcomes target on the target groups, persons affected and the family members. It will improve the cap of the knowledge, attitude, and practice of this group of individuals, improvement in activity levels and social participation. It will improve also the family quality of life, the mental well-being. Because of the improvement of the knowledge, attitude, and practice, stigma also will be reduces. Socio-economic empowerment also will be expected to improve. On the concert output deliverables, again, we will have a number of published articles. I myself will complete my PhD. Again, the output also is very important for programmers, policymakers, and implementers. For this, I can say something about just what I previously done. I called upon the Regional Health Bureau and I present for the programmers one of our research findings from our previous research work. Thank you. I will acknowledge this group of individuals, Institutional Research Ethics Review Committee of Debre Markos University, 2 zones and 3 Woredas health officials, the research assistants, and the study participants, as well as just this for organization, the Leprosy Research Initiative for funding disability studies in the Netherlands. Is just the research team members. The Ethiopian National Association of People Affected by Leprosy is just our lead project program leader, and Debre Markos University just research team. Finally, I would like to say thank you all.